Hi, my name is Reagan Moore, and I did my final project on global aphasia and loved ones' relationships. So, what is global aphasia? According to the ASHA website, global aphasia is a type of non fluent aphasia with severe impairment of both expressive and receptive language skills. This is usually associated with a large left hemisphere lesion in the brain. People that suffer from this are often alert and may be able to express themselves through facial expressions, intonation patterns, and gestures. But beyond that, their ability to communicate and to use language is often very limited and impaired. It's important to note that aphasia is an acquired language disorder. It is the result of damage to the brain occurring within a patient, and this damage is often due to a stroke occurring. Um, Aphasia has many different types that fall underneath that umbrella term. And if you were to take those types of aphasia and line them up on a spectrum from mild impairment to a more severe deficit that's seen within a patient, global aphasia would be on the most severe form of that spectrum. And this is because of the severity of the brain damage that's apparent within an individual. Often with a stroke, there's initial improvement and there's a window of opportunity for improvement to be made, but this of opportunity is dependent on what's been damaged inside of the brain. And when global aphasia is present, it's due to extensive injury, and this often results in a lasting disability for the patient. Unfortunately, the prognosis is really poor for an individual who's suffering from global aphasia. Um, there are approximately 25 to 32% of all people living with aphasia that are living with the global aphasia, meaning that their injury to the brain was extensive and their deficits are great as well. And the damage in the brain often affects the capacities to communicate and the areas in the brain that are devoted to language function, including Broca, Wernicke's, and the anomic areas within the brain. And much of these capacities are lost to communicate as they were once present. And in this being lost, much of the individual themselves are lost. And that's a very hard concept and a hard realization for loved ones and family members and friends of the patient to grasp and to move forward with. So, in knowing the severity that global aphasia presents, it's evident that differences within that individual are going to be apparent, and that there are going to be deficits within the person's communication and language capabilities, and there's going to be a change in their independence level and how dependent they now are going to be on the ones who surround them and their loved ones and family members who rally around them during this time of change. And specifically with the communication deficits, there is going to be impairment to both the expressive and the receptive language skills within this person, meaning that producing spoken language and language comprehension and reading and writing are often going to be impaired and not going to be at the level they once were before global aphasia presented itself. When a person is living with global aphasia, their capacity to communicate is diminished and their entire gamut of communication skills is impaired. In starting with minimal speech production, patients that have global aphasia are typically nonverbal and they don't speak at all. However, if they do speak, they use utterances that are recurring and they may string together a couple of words, but these words do not necessarily articulate their thoughts or communicate complete thoughts at that. There's also a limited ability to read and write as they once were able to do these two deficits are often very present, and there is this kind of transpires into their ability to comprehend visual stimuli. If you were to write down a sentence or write down a couple of words and put it in front of a patient who is living with global aphasia, their ability to comprehend what's on that paper is often very poor, and they're not able to take in the or written work or the pictures that are in front of them and make sense of that stimuli. There's also difficulty in naming, repetition, and confrontation within patients who have global aphasia. Um, as stated before, the expressive and receptive language capabilities are very diminished when this is present. Some preserved communication capabilities within patients who have global aphasia are they're often able to combine a couple letters and words together on a piece of paper. However, as stated, if they communicate a thought or if they communicate an idea or just a need, that may not be present at all, but their ability to put together letters and words may still be intact. They're often able to copy and mimic facial expressions pretty well, and their ability to use intonation or the rise and fall of speech when potentially speaking, that's often preserved. And their auditory comprehension is much better than their visual comprehension, meaning if a loved one or a doctor were to come in and speak to this person, their ability to comprehend what they are saying may be intact, and it's often a lot better than their visual comprehension skills. Um, but this often looks different and is diminished if you were to compare it to prior life or prior to the stroke that this person has endured. So, in knowing the deficits and the capabilities that an individual living with global aphasia now has with communication, their loved ones may be asking themselves, what role do I play in the progression of this individual and how my loved one can move forward? And it's important to state very clearly that loved ones are vital components within treatment of aphasia, and what they do really does help and improve the individual living with global aphasia and their progress that they make. Um, these different strategies and easy techniques to implement include the simple task of inclusion of the person who has global aphasia, making sure that they are a part of conversations and a part of activities that are going on, really just being inclusive with them rather than excluding them from what's going on, allowing for the person who has global aphasia to have plenty of time to speak or to communicate in whatever form they may be able to, it is important as well. Also, to minimize distractions and using less complex sentences when you're around this person also helps for communication to be fluid and for it to be helpful. And simply maintaining natural conversation as well as encouragement with the individual who has global aphasia will help in practicing all modalities of communication. And encouragement is a huge piece that loved ones can easily and readily implement in the progression of moving forward with their loved one who is now suffering and living with aphasia, and specifically global aphasia, and how that alters the family dynamic. I was able to find a really cool article that was specific to my topic that I'm discussing, and the article was titled Living Successfully with Aphasia, Family Members Share Their View. And the article was really neat and really candid in giving the perspective of family members who have loved ones who are living with aphasia and what that looks like, and how life can continue to be successful even with this acquired language disorder that's present. So the study was conducted in 2011, and it was performed on 24 family members who were living successfully with a loved one who had aphasia. And the relationships that these family members had with the person in their life who was living with aphasia included a person's spouse or their sibling, as well as a parent and a child. And it just needs to be noted that all of these individuals were aged and elderly when this study was performed. These were not done on children or younger candidates. Specifically, 6 of the participants who had loved ones involved in the study, they were suffering from mild to severe aphasia, and so I felt it was practical to use this article because severe aphasia was included within the study, which elicits that global aphasia was probably present within some of these individuals that were involved. Thorough interviews were conducted with the family members that were a part of this study, and there were some pretty neat themes that were found among the family members and how they are successfully living with loved ones who have aphasia. And that's what I'm going to get into. So, there were 7 different themes of success that were described within this article, and I'm just going to go through all 7. And the first one was in living successfully with someone who has aphasia, involvement in life is important. And that was simply just going over family members are actively engaging their loved ones in activities and in conversations and just in daily life and routine. And in doing so, this is eliciting success in moving forward with life and with the future beyond the initial days that aphasia was presented within their loved one's life. And support was another theme that was found, and that was simply empowering the person who's living with aphasia that they can improve and they can move forward, even though their communication and language abilities may be different now, but they're able to move forward. And just being a really solid support team was a huge theme that was gone over within this article. Communication was another theme, and just the task of conversing with the patient who has global aphasia, just including them and continuing to speak to them was a way that success was occurring as well. Another neat theme that was found that I thought was really, really cool was that family members were candid in saying that they had to remember to put their needs on their priority list as well, and not only be focused on the loved one who is living with aphasia, but to remember that they are important as well, and to practice some self-care, which I thought was really neat to be added in. But it makes sense that it's part of the successful process. You can't neglect your own needs and put someone else before you if you're not taking care of yourself first. So I thought that was really neat to include. Putting life into perspective was also a theme of success, and communicating to the person living with aphasia that this is just part of the journey and that you're going to move forward and you're going to get progressively better, and it may take some time, but it's all part of the journey. And just letting them know that you're going to do it together. And that really led into celebrating strengths and improvements that are found within the person that's living with aphasia, and just really maintaining a positive outlook and a positive attitude in moving forward with communication capabilities and their ability to use language effectively. That celebrating the strengths rather than any weaknesses or negative components is always better, and always elicits progression and ultimately success. And last but not least, having loved ones involved in the experience of services that are provided to the patient and loved one who has aphasia was also crucial. And that really went into being actively involved with speech services and occupational services and just any type of therapy that the person is getting, to include the loved ones in that process and to really educate themselves in what's going on and how they can implement techniques and strategies to improve just quality of life at home for the person living with global aphasia. And when you put all of these together, you just have a really great and encompassing list of how to be successful in living with someone or alongside of someone who is is living with a different component added to their life, and it really alters the way that they function. And it's ultimately a team effort, and it takes everybody doing their part to really rally behind the person living with aphasia and how they can be successful in moving. I really liked at the end of this article, after it went through all of the ways to be successful in living with someone who has aphasia, how it went down, and it stated very candidly the quote that's on the slide, and it says, findings provide evidence to support previous research indicating that aphasia affects the whole family and not just an individual. And I just really liked that. I thought it was very candid in saying, aphasia, it may be only present within one person, but that one person is so interconnected to so many other people, and their loved ones and their family members and friends are ultimately all affected when aphasia presents itself. And even though it's presented only in one person, it really affects an entire gamut of people. But as the article went through in great detail, success can be found in that. And I thought that was really inspiring, and I really liked the way the article stated that. So, in learning about global aphasia, I had the opportunity to do a face to face interview with one of my friend's mom, named April Hopkins, and I was able to get kind of an inside story on someone who was really precious to her and to her family, and how global aphasia impacted and touched the Hopkins lives. This is Dr. Nancy Bush Priest, and she was lovingly called Nanny, as April Hopkins so quickly pointed out. And this is the woman that I was able to sit down and learn more about, and I got to learn about how global aphasia not only impacted her life, but also affected all of those family members and loved ones and friends surrounding her, and how that changed all of their lives. So Nanny was a beloved family friend of the Hopkins family, and she was also the godmother of the Hopkins girls. And April went on to tell me about how successful she was and how educated she was. She attended the University of Georgia and ended her educational career with obtaining a PhD in administration. And she was very smart and very bright, and she really loved music. She enjoyed the atmosphere that music brought, and being around people who loved it as well. And um, I asked April to give me a couple words that really defined Nanny throughout the entirety of knowing her. And April said that being regal and intelligence and dignified were three words that really encapsulated who Nanny was. And in moving forward, I want those words to remain present in your brain. They are three words that April said that describe Nanny throughout the entirety of her life. And even whenever the stroke that I'm going to get into occurred, she remained these three characteristics. And so I hope you remember those three things in moving forward in this presentation. In February of 2010, Nanny woke up one morning and was very much not herself. She had a live-in caretaker at the time, and the caretaker noticed the significant and immediate changes in Nanny's appearance and behaviors and took her to the hospital that morning. And Nanny had suffered from a massive stroke, and this stroke caused extensive damage to her. And ultimately, 1 month after this happened, Nanny would pass away because of the stroke that her body endured. And but during those initial days after the stroke happened, Nanny had had irreversible damage that occurred. And this was very telling of what was to come of her life. And she was diagnosed with global aphasia. And this was on accounts of her ability to communicate, and she had extreme receptive and expressive deficits, and these were not apparent before in Nanny. And she didn't have any facial paralysis because of the stroke, but her state and um, being after the stroke happened was very confused and childlike and frustrated. And April mentioned that Nanny wanted to be helpful in the mix of all this, but this newness to her personality and her demeanor was not who Nanny was prior. And in terms of her speech, April described it as garbled, and I'm going to get into that coming up. But Nanny suffered a massive stroke, and in because of this stroke, global aphasia was presented into Nanny's life, and the global aphasia affected Nanny with her communication and language capabilities, but because of it, her family and loved ones also experienced great changes and differences, and had to learn how to recommunicate with this beloved person who was always seen as a superior and a role model. And Nanny was no longer that person. I asked April to tell me more about how they began to communicate with Nanny and how that looked different than it was prior. And the interactions with Nanny involved close communication, and it involved being close to her bedside when speaking to her and speaking in a very direct and clear manner, um, in communicating whatever needed to be told to her. And Nanny found some comfort in the faces and the voices of familiar people, and those familiar people were her loved ones. And her loved ones understood very little of what Nanny tried to communicate back, and but they continued to speak to her, and they continued to include her in what was going on in her life, and what was going on in the hospital, and also what was going on outside of the hospital walls, and just keeping her in the know. And there was some breakdown in whether or not she actually understood all that they were saying, but in turn, her loved ones didn't understand all that she was saying as well. Um, some tools that were utilized in facilitating interactions with Nanny was there was a book that was filled with loved ones' photos, and Nanny would often look at that, and that would be a topic of conversation between her loved ones and herself. And the speech language pathologist that was involved in Nanny's life gave her a chalkboard, and the SLP would write on the chalkboard and give it to Nanny, and Nanny in turn would write back on it. And so her loved ones kind of picked up this practice and used the chalkboard as well to communicate thoughts and ideas. But um, when Nanny would write back on the chalkboard, she could put a couple of letters together, and but the rest really wouldn't communicate a thought. And that was much of Nanny's ability to communicate. She could communicate with a couple initial words, and some of the words that April told me she was able to say were I, go, and then the introductory statement of a clause. So I think that, but whatever would follow from that clause would not make any sense. And so there was a lot of pretend that happened. And um, in speaking about pretend, there was an element that this was hard for the family and Nanny's loved ones to have to play pretend in understanding what Nanny was trying to say. But ultimately, to reduce frustration and in Nanny's life, trying to understand all that she was saying was not possible. But the ability to capture hopefully a piece of what she was trying to communicate, and then just nodding and ultimately pretending that they understood all that she wanted to say, was just a new element of interacting with Nanny. And April said that that was one of the hardest parts, and in the impact that the stroke had on Nanny's life. And um, it changed her perspective of
nanny, from a coach and a leader and a mentor, to someone who was very much not herself. And this was attributed to global aphasia and the impact that it had on Nanny's life, and ultimately the impact it had on the lives of all of those who loved and surrounded Nanny.
In conclusion, I found a really cool article that I wanted to include in this PowerPoint. I didn't go over it in the information that I covered, but I wanted it to be a supplemental resource that someone could go to if they were intrigued about global aphasia and wanted to learn more about how language can be learned. And so this article goes through a study that was done on 7 individuals who were diagnosed with global aphasia and how they were trained and ultimately learned an artificial language that was based around symbols and how they used this. And I just thought it was really neat to include. And I hope that whoever goes and checks out this article finds it helpful and resourceful as well. And overall, I just want to say that I really enjoyed this project. I enjoyed um, the chance to learn more about global aphasia and have the opportunity to sit down and go through a really personal interview with someone whose life was a touched whose life was touched by global aphasia, and ultimately how loved ones are so vital in the improvement of people who have global aphasia, and how family members are just important all around. And I think family is important, and my loved ones are near and dear to me, and I know that life happens, and people change because of really awful situations. And when aphasia presents itself, um, specifically global aphasia, it can often be detrimental, but there are ways to be successful, and there are ways to move forward, and family members are such a huge component in that story, and in moving forward. And I just really hope that my project communicates that, and just my passion for um, loved ones, and more importantly, how excited I am about global aphasia and just the opportunity to learn more about it. So I hope you enjoyed this presentation, and my works cited are to follow. Thank you.